And welcome to Better Together Talk with the Docs. We are so happy that you could join us this evening to talk about vaccine hesitancy and to have a few questions answered about the COVID-19 vaccine. So before we begin, I'd like to go over a few house rules and then I'll introduce this morning's speaker, who is Dr. Robert Hopkins. So first, we'd like to ask you to please keep cameras and microphones off in order to keep down distractions. And I'd like to remind everyone that this session is being recorded. Secondly, please keep all questions in the chat box and we'll be monitoring questions for our question and answer session. And then lastly, please stick around for the question and answer session at the end of our session. And also for a survey, which will be posted in the chat box later. Also, if you don't mind, please keep your zip codes in the chat box to help with our demographics. And now on to our main event, which will be our questions from the docs, our talk with the docs session, I'm sorry. So Dr. Robert Hopkins Jr. is a professor of internal medicine. I don't know where I got international medicine from, I'm sorry. Of internal medicine and pediatrics and serves as the chief of division of general internal medicine, associate program director for the MedPeds residency and medical director for COVID testing and vaccination at the University of Arkansas for Medical Sciences. Dr. Hopkins' primary academic interest is clinical vaccinology with emphasis on education and quality improvement. He has held a number of national and local leadership positions, including current service as the chair of the National Vaccine Advisory Committee and as a member of the Arkansas Department of Health Vaccine Medical Advisory Committee. Dr. Hopkins maintains board certification in the internal medicine and pediatrics and continues as an active teaching and clinical practice. And now we're going to turn it over to Dr. Hopkins.
Thank you, Andrea. I'm glad to be with you here today and talk to you a little bit about some of the issues around vaccine hesitancy and about the COVID-19 vaccines in particular. So what is hesitancy? You know, hesitant is a word that has been out in the media an awful lot here lately, but you know, I think it's important that we think about what does the word really mean and why should it be important to us? Well, the definition of hesitancy is to be doubtful or uncertain about something. And you might think about hesitancy in terms of being skeptical, being undecided, or having an iffy response to something. So hesitancy can apply to anything in your world. You know, I am hesitant to order a hot dog because I don't know what's in it. I'm hesitant to go to a fast food restaurant because I know I might eat too much. Might be another couple of things to frame hesitancy in a conversation. Hesitancy surfaces in a lot of different ways in our life. You know, this example ties in with what I said a moment ago. A person can be hesitant about eating French fries with dinner when they're on a diet, or they can be hesitant about taking an important medical exam. You can even refuse to take that exam for a number of different reasons. So there are lots of different degrees of hesitancy, but how does that apply to COVID-19 and to vaccines? The phrase vaccine hesitancy has been used frequently in the media and even in our everyday conversation. And I think it's important that we think about where that applies and take a moment to talk about vaccine hesitancy and another term that I think is equally important, and that's vaccine confidence. You know, how confident are you in the vaccines and your healthcare team? So what are vaccines? According to the World Health Organization, vaccines are products which reduce the risk of getting a disease by working with your body's natural defenses, your immune system, to build protection. And vaccines, we can trace their origin back to the early 1700s in Europe when a couple of very bright, a number of very bright people discovered that if you took the product from a sore on a cow from a disease called cowpox and scratch that into the surface of a human's skin, you could reduce that person's susceptibility to getting smallpox. Cowpox is a disease that didn't cause disease in humans, but that cowpox exposure could help protect someone from the disease smallpox, which killed millions of people across the world. So why does smallpox matter? Why mention it at all? Well, we continued to vaccinate with smallpox using that variolation process and then development and purification of that into a better vaccine that had less side effects. And in May of 1980, we had done this widely enough around the world that the world was declared completely clear of smallpox, a disease that plagued the countries for centuries. It made huge impacts in the settlement of this country. Smallpox wiped out many of the Native American populations across the United States prior to us becoming a country, and has been thought of as even used as a biological weapon in some societies. So it really caused devastation. Well, we have a history with vaccines going back many, many years. So what does this have to do with COVID-19? And what does this have to do with you today? Well, today we have vaccines used to keep us safe from a tremendous number of infections. And there are also vaccines that are being used therapeutically to treat cancers and a number of other things. But we're going to focus on the infectious disease implications today. But some of the vaccines that we have available to protect us from disease, protect us from influenza or the flu, from measles, from mumps, from a bacterial pneumonia caused by a bacteria called pneumococcus, polio, rabies, rubella, or German measles and tetanus. And when we get vaccines, they stimulate our immune system to build a response, to build antibodies, to build types of cells called T cells and B cells that help protect us from these infections. And these antibodies and cells help us to not get sick when we get exposed to an illness, or even if we do get a little sick, they reduce the severity of that illness because you're stimulated. So the CDC talks about using these vaccines to imitate an infection, cause your immune system to jump into action to create these antibodies and lymphocytes. Some of these cells provide memory, give you a ability to respond even over a period of months or years following that vaccination. Others make antibodies that float around in your bloodstream to respond immediately if you get exposed. But the important thing to remember is that for COVID-19 and for most of these diseases, we are not giving anything live to you. There's no live COVID-19 virus in any of the COVID-19 vaccines. None of them could any live coronavirus, so you cannot get COVID-19 from these vaccines. There are a couple of vaccines we use that are live virus vaccines, and those have restrictions against using them in people with impaired immune system. COVID-19 doesn't fit into that group. So since the beginning of the time when we've had vaccines available, though, there's been hesitancy about them. So what does that vaccine hesitancy really mean? So according to this group of authors in 2015, they wrote an article called Vaccine Hesitancy, Causes, Consequences, and Call to Action. Vaccine hesitancy reflects concerns about the decision to vaccinate oneself and or one's children. There are varying degrees of that vaccine hesitancy, from outright refusal to take a vaccine to just being a little concerned about the vaccine, to even some just needing more information about the vaccine in question. And if we look at vaccine hesitancy in general, probably a much larger proportion of the population fit into those groups that say, I'm a little concerned or I need more information, although there are still some who outright refuse. So why does vaccine hesitancy occur? There are a tremendous number of factors that participate in this vaccine hesitancy, and it's, as we talked about, it's not new. It's been present since the 1700s. People were skeptical back when vaccines were first developed. The common questions were, would this new medication be safe? Would it be effective? Would it have a better outcome than getting the disease itself? And these are some of the same types of questions we get today when it comes to the COVID-19 vaccines. So let's go back and try to remember what hesitancy remembers. Remember, it's uncertain or skeptical or having an iffy response. And so sometimes if we become hesitant or skeptical or iffy about something new, something we're unfamiliar with, that's a normal response. But we can either let that normal response block us from thinking or talking about something that may be helpful for us, or we can use it as an opportunity to ask questions. And hopefully this is an opportunity to ask those questions and answer some of those questions. So today, I want to share a little bit of information about the COVID-19 vaccines that will hopefully help settle your minds, clear up some of the misinformation that you may have heard or read. Also going to share a little bit about some of the experiences I've had with the COVID-19 vaccine if you have questions. So I'm going to start with talking about 3 common COVID-19 myths that are circulating around social media and on the internet today. The first one is the myth that I will get COVID-19 if I get COVID-19, or I'm going to get COVID-19 disease if I get COVID-19 vaccine. We'll talk about in just a moment why that's absolutely not true. The second myth is if I get COVID-19 vaccine, I may not be able to conceive or have children later in life. Again, absolutely false, but we'll talk about that in just a moment. And then the third myth that has a hint of truth in it is the vaccine was created too quickly and I don't trust it. Trust is a major component in anything we do in our lives, but particularly when it comes to healthcare. These vaccines were developed relatively quickly from the time that we really were focusing our efforts on COVID-19, but that rapidity relied on a foundation of lots of research over 20 plus years to get us to the point where we were able to develop these vaccines in a relatively short timeline. So the first myth, the myth is that you can get COVID-19 illness from COVID-19 vaccine. This is false. When you receive the COVID-19 vaccine, you receive parts of the material from the COVID-19 virus that tell your cells how to fight off the COVID-19 virus. We do not, in any of these vaccines, give you the virus in total. We don't give you more than just a small component to help teach your cells how to fight. There's no way that you can get COVID-19 from the vaccine. Now, when you give any type of material to a human being that stimulates an immune response, that immune response often goes with symptoms. Soreness or pain at the site where you get the vaccine, fever, aches, sometimes your lymph nodes in the area will swell. All of those are normal parts of the immune system and do not indicate that you have an infection. So those side effects, or what I call reactogenicity, we get a reaction that tells that our body is responding, do not indicate infection. The second myth that's out there is that COVID-19 can affect people's fertility or sterility. This assumption is false. There is a great deal of social media misinformation out there on this very popular belief. It's interesting. There's been a lot of research done over this last year and a half that we've had availability of these vaccines. We've given in this country well over 230 million doses and have actually shown no impact in fertility in women. There's actually one study that showed that there may be a slight increase in sperm production in men. Now, it's one study that's very small, but we know that it doesn't have an adverse effect on men's fertility or women's fertility. We also have seen no evidence that the COVID-19 vaccines cause any problems with birth defects or other adverse effects in pregnancy. And we know that COVID-19 itself can cause severe infection in pregnant women. It can cause pregnancy loss. It can cause stillbirths. And so the CDC and the obstetric healthcare groups strongly recommend that pregnant women be vaccinated to reduce their risk for losing their baby or for having severe illness during pregnancy. The third myth was that the vaccine was created too quickly and the concern about trust. As I said, research around coronaviruses have gone back to the SARS outbreaks in the early 2000s, the MERS outbreak in 2013, 2014, These were other coronaviruses that caused illnesses. They didn't become as widespread or cause a pandemic like SARS-CoV-2 or COVID-19, but they gave us a jump start on working on vaccine development around coronaviruses. When we saw the COVID-19 outbreak, that was the foundation for our research that led to the development of these vaccines. All of the standard and necessary steps to evaluate how well the vaccine works, how safe the vaccine is across different populations have continued to be implemented for our COVID-19 vaccines. And I, having been somebody that's looked at the safety side of these vaccines from the beginning, these vaccines are safe and effective in the groups that they're authorized to be used in. I think there are many of us in the community who would love to see these vaccines available in small children, but the reason we're not using this vaccine in children under 5 is we don't have that evidence yet that shows that they're effective and safe. When that evidence has been developed, it's been authorized by the Food and Drug Administration and the CDC, we hopefully will start vaccinating those younger kids. So we have safe and effective vaccines in children 5 and older, and hopefully soon we'll be able to vaccine protect those younger children. All vaccines that are used in this country have to be approved or authorized by the U.S. Food and Drug Administration. The Food and Drug Administration collaborates with the European medicines agencies and other drug authorization agencies in other countries around the world. The Centers for Disease Control then evaluates those vaccines for use in people after the FDA approves them. And the vaccines we have available have gone through that process. And now we have vaccines from 3 companies available in this country. We have the Pfizer vaccine, the Moderna vaccine, and the Johnson & Johnson vaccine available for us to use. So at this point, let's talk about a couple of questions, if you have some questions for me. And I'm going to turn off the screen share. We do have some references in the slide set, and Andrea can make those slides available to you also. So are there any questions available for us?
Yeah, Dr. Hopkins, there are a couple that have popped into the chat. One of our participants asked, what have you found to be the most productive way to discuss COVID vaccine info with individuals who distrust the CDC or public health entities as a whole? And a follow-up to that is, has there been one piece of information that you have found to be most helpful in combating vaccine hesitancy?
Well, both very good questions. It is really difficult to get through to people that distrust all the public health entities. What I tend to focus most of my discussion with groups of people or with individuals on is I talk about what I see every day in my practice of medicine. I talk about what I've done to protect my family. And so generally, I'm going to start a discussion with an individual or group with 3 points. The first one is that I am somebody that's been practicing medicine now for over 30 years. I have looked at all of the scientific research that's been published, well, a lot of scientific research. I shouldn't say all. I don't know that there's any way that someone could look at all of the research, but I've looked at a tremendous amount of scientific research around the COVID-19 vaccines. And the data that I see shows that these vaccines are highly effective for reduction of risk of severe disease. They're a little bit less effective to protect people against getting COVID infection. But the data is strong enough that I've been vaccinated. Every member of my family has been vaccinated, including my 11-year-old daughter, my 25 and my 23-year-old sons, my parents who are in their mid-80s, my brother and my brothers and sisters, sister-in-law, who, I've talked to them about it. I don't have control over their bodies, but I've talked to them about it. And I would like to see my patients and my community have the same degree of protection against this infection as I've provided to my family. My healthcare team that I work with here at UAMS have all been vaccinated. We are at present under a federal mandate that if you work in a healthcare institution in contact with patients, you have to be vaccinated. And personally, I think that's a good thing because that provides a layer of protection to the people that we are serving in healthcare. But, if I don't have trust established with you, if you don't trust what I'm saying, then that may not have much of an impact. So the first thing I try to do is establish trust. The second thing I try to do is to establish a bit my credibility. And the third is I try to help people know why I make the recommendation that I do. And I try to avoid the last piece of information, which is focusing on death and disability. And I just leave that with a statement that I have unfortunately taken care of, at this point, hundreds of people who've had COVID-19. I've seen the devastation in families who've lost someone to this disease. I have seen the look in the eyes of people who are getting ready to have to go on the ventilator. I have seen the horrible things that have come from this disease, and looking at the numbers in this country and around the world of millions of people now dying from this. If we can stop and prevent some of those severe outcomes, we're doing something good for our community. And it is, in my view, much healthier to prevent something than to have to deal with it down the road.
Okay, that's awesome. We've got another question. How do we reach folks who are hesitant about the vaccine when they're not listening to their providers?
That's a tremendous challenge, and probably an even greater one is if you've got a provider that's giving people misinformation about the vaccine. There's some problems with that in our communities also. And when somebody doesn't have trust in their healthcare provider about an issue like vaccination, I think the first question I ask is, do you trust them about other aspects of your healthcare? If you're going to trust me to treat your high blood pressure, your diabetes, to take care of you in the hospital for pneumonia or for a foot infection, or after you have a heart attack or a stroke, why would I give you guidance about a vaccine and say that I want you to have this as safe and effective and treat that any different than treating you for a heart attack or a stroke? I'm not getting anything out of vaccinating you. This vaccine is provided by the government. I don't get paid for vaccinating you with this vaccine. I'm doing this to try to help you be a safe and healthy member of my community. And if somebody doesn't have trust in their healthcare provider, they, really need to evaluate whether this is the healthcare provider they need to be seeing. They may need to think about looking out, searching out for another healthcare provider they're going to have more trust in.
Okay, thank you. There's another question here. For the public who wants to learn about adverse effects that have been reported, is there a particular resource you would recommend for the public to access? And maybe also give some information about what exactly is the reporting mechanism for adverse effects?
Well, there are a number of different processes in place looking for adverse effects regarding the COVID-19 vaccine. We've had a historic undertaking to get to where we are with vaccination. And in order to monitor for the safety of these vaccines, we've used two systems that have been in place for a number of years. One that's called the Vares System, VAERS. The Vares System is a system where you as a member of the public, me as a healthcare provider, or anyone can report a potential adverse effect they have after a vaccine. That passive reporting system, they require a specific set of information. You don't have to fill out the whole form, but the more information that the CDC and the Food and Drug Administration receive, the better they're able to assess these events. But this passive reporting system has been a great tool. There's also a network of healthcare institutions that are actively monitoring vaccination of everyone within their healthcare systems. This is called the Vaccine Safety Data Link. So every person in the hospitals that use the Vaccine Safety Data Link system that receives the vaccine is monitored actively through their health records over a period of time after vaccination. So actively trying to match, did their adverse events occur? When were they in relation to the timing of the vaccine, and what happened? So those two systems were in place before COVID-19 vaccination, have been very important in monitoring the vaccine safety. CDC and other collaborators have also put out a system that's brand new for COVID vaccination called vSafe. vSafe is a smartphone system where you register and you get sent electronic surveys by text message over the time after you're vaccinated to monitor for symptoms and signs that you have after vaccination. That's also provided us good information. So these three systems, along with some other systems that look at things at the back end by drilling through medical records, by assessing particular populations, have all been used to assess vaccine safety in our country. If you go to the CDC website has 2 or 3 tools. One is you can Google on the CDC website for COVID vaccine safety, and you will see hundreds and hundreds of articles that have evaluated the safety of these vaccines and can look at that. You can look at the CDC's clinical considerations page, which tells you what the recommendations are from vaccine experts at the CDC and across our nation for using the vaccine. When are times you shouldn't give it? When are times you should give it? What are the things to be considered? And those are both very helpful tools for people to use. The National Library of Medicine has got a number of very good and useful tools. And the National Institutes of Health also have some good information about vaccine safety.
Okay.
And I'm going to make a plug here. I just noticed Andrea has put a survey in the chat. If you would please fill out the survey so that we know whether this has been helpful to you and help us to better tailor offerings to help with your knowledge about healthcare conditions in the future. Anything else?
Okay. There was one other question. Early on we heard about reports of cardiac adverse effects in young individuals. What's the current status on that right now?
So there have been a number of reports of young men who've received these messenger RNA vaccines that have developed a condition called myocarditis. Generally, they present with chest pressure or chest pain that occurs in the first few days after the vaccine. It appears that they have inflammation of their hearts. And the data that we have so far is, while this does occur, it's not a common event. It's more common in teenagers than it is in younger kids. It's more common in teenagers and young adults than it is in adults after the age of 25. But it appears that the people that have this condition, generally it resolves in a fairly short period of time and doesn't appear to cause any long-lasting damage. Now, it's important to recognize that myocarditis, as well as heart attacks and other adverse cardiac events, are very common events with COVID-19 infection. And so if you look at the risk for having heart disease related to COVID-19 compared to myocarditis with the vaccine, the risk is far greater from COVID-19 infection than it is for myocarditis with COVID-19 vaccines. Been a couple of other unusual adverse events that have been linked to the COVID-19 vaccine. One is anaphylaxis. Anaphylaxis is a severe allergic reaction. Anaphylaxis has appeared to occur with the COVID-19 vaccines at a rate that's between 2 and 5 cases per million doses of vaccines given. It's uncommon, but it is something that we watch out for. And that's part of the reason that we ask everyone before they're vaccinated, do they have a history of severe allergies? Have they had allergies to medications or other vaccines? Because people that have that allergy history, we need to monitor a little more closely, because if they have a reaction, we want to treat that reaction immediately. The other two very unusual side effects that have been detected are primarily associated with the what we call the adenoviral vector COVID-19 vaccines. That'd be the Johnson & Johnson vaccine we use in this country and the AstraZeneca vaccine that's used in a number of other countries. People that have received those vaccines, particularly women in their 40s and older, have been shown to have some unusual clotting disorders, blood clots, and including some clots in some of the venous sinuses around the brain. And so that's a precaution. Again, very, very unusual. And there also have been a few cases of a neurologic disorder called Guillain-Barre Syndrome that have occurred in older men who've gotten those adenoviral vector vaccines. But again, these are all conditions that are far more common with COVID-19 infection than they are with the vaccine. But we have seen these, and they're things that we're watching very carefully. Other questions?
Awesome. Okay, thank you so much. I think that is all the questions we had in the chat box. So Andrea, you want to wrap up?
We'd just like to say thank you so much, Dr. Hopkins, for coming and presenting for us and teaching us about the benefits of the COVID-19 vaccines, and also about vaccine hesitancy today. So if anyone needs any more information on COVID-19 vaccines, please reach out to us here at the UAMS library or your PCP. They'd be happy to share what knowledge they have, which I'm sure is a plethora. We here at the UAMS library have lots of reliable and credible information through our resources. We're not healthcare professionals, but we can guide you to healthcare professionals and through resources through our databases. So thank you for listening and for coming and sharing, Dr. Hopkins. And that is all we have for you this morning.